Good afternoon. Well, it looks like the heat is on, isn't it? So we're glad to have you join us this afternoon for a very interesting discussion on youth violence prevention, from bullying to broken windows, what's happening to our kids. Senator Rebecca Warren was going to introduce our speaker, but as you know, our state legislators are hard at work today. So in her place, I get the opportunity to mention that we have a number of people in the room today that we're happy are joining us. Vice President Cynthia Wilbanks is here with us today, and Nick Tenbrink from Representative Sean McCann's office. We thank you for joining us. And also, I'd like to just mention how appreciative we are that the Michigan Government Television is filming today. This is an opportunity for people across the state of Michigan to see these substantive forums that all of you are sharing with us. And also from the generous support of the Michigan Alumni Association, we are able to do these forums. So thank you again for being here today. And now I'd like to introduce our illustrious speaker, Professor Marc Zimmerman. Marc Zimmerman directs both the Prevention Research Center and the Michigan Youth Violence Prevention Center in Michigan. One of the accompanying programs, the Youth Empowerment Solutions, or YES as we call it, works in conjunction with the Flint Community Schools and the Genesee County Intermediate School District. Through YES, high-risk youth have opportunities to learn and practice empowerment skills and establish social and cognitive resources that will help them effectively navigate and change their social settings. And don't we really need that in today's society? So without further ado, I'd like to invite Professor Marc Zimmerman. Bring it on.
Well, thank you for inviting me to be here today. I appreciate it. I always like to talk about our work because we certainly believe in it. Let me just quickly tell you, as a professor, I hope I'm a little bit more exciting than the stereotypic professor, but I will have some boring moments, I'm sure. I'm going to talk first a little bit about statistics. That's a hot topic and really keeps you awake in the morning. I'm also going to talk a little bit about theory. So if statistics doesn't bore you, then theory for sure will. But I will promise to briefly do that. And I'm going to end with talking about two programs where we've taken theory and the statistics and we're trying to do something about the problem. So just hang in there, and if you kind of feel your eyelids getting a little heavy, I'll hopefully wake them up. So let me just tell you start first with some data from that didn't work. Oh, there we go. So basically what violence is. Violence is on purpose, it's against another person, and it causes harm or death. So that's what we're talking about here. We're talking about kids doing these kinds of things to each other. The harm to another person can be psychological or physical. It doesn't have to end in murder, in death. It can be psychological. I think some of you might be interested in bullying and those sorts of things. That's also in the rubric and in the context of violence. So I want to let you know about that. This number is the number of kids who've been bullied in school with our latest data, which is from 2009. You should also know that's 1 in 5, by the way. So I think there's about 40 people in this room. So that would be about 8 of you would be bullied, would be a victim of bullying. So just to put that in some kind of perspective, in a class of 100 students or a school of 100, that's 20 kids. That's a lot of kids in that population. You should also know that cyberbullying, I know that's getting to be a very hot topic these days as we get more social networking and as we see the news that's going on and how that can be used for intimidating people or all sorts of things. The data so far suggests that about 4% of kids have reported being bullied on the internet or through some kind of cyber space. Now, that number I suspect will increase over time, and so we'll see about that. 32%, this is the number of kids who have reported being in a fight nationally. So 1 in 3. So last time it was 1 in 5. This is 1 in 3 kids have reported being in a fight. I think we all grew up and watched fights in our high schools and that sort of thing, but those are not positive behaviors that happen, of course. 6% carried a gun. Carried a gun in the last 30 days. These are 10 to 24-year-olds who reported carrying a gun. That number is about the same in the state of Michigan. 18%, again, about 1 in 5 reported carrying some kind of weapon. So we're talking about kids carrying weapons. High school age kids. 656,000, that number is the number treated in the emergency departments across the nation in, I think there was also 2009. So over 500,000 kids were treated in the emergency department for injuries sustained from a violent incident. 16, this is the number of kids, youth, aged 10 to 24 that are murdered every day in the United States. To put that into some perspective, Columbine, I think you've all heard about Columbine, made the big news several years ago. Horrific incident, 12 people were killed. Several more were injured, but 12 people were killed. More people die every day in the United States than were killed in Columbine. Number 1, that's the number 1 cause of death for African American kids in the United States is homicide. For all kids in the United States, it's number 2. So we're talking about, and this again is 10 to 24-year-olds. So we're talking about a significant health problem as well as every other problem you could think of, but violence is a public health problem. 15, this number represents the number of times the greater that an African American kid in the United States will die by homicide than a white kid. So an African American kid is 15 times more likely to die by murder than a white kid in the United States. So let's turn to the state of Michigan. Both peninsulas, by the way. This number is indicating the number 1 most violent city in the United States of America is right here in our state. Does anybody know what city that would be? How many people say Detroit? I heard Detroit. Anybody else? Any other cities? Flint. Flint is the most violent city in the United States and in the state of Michigan.
In the United States?
In the United States and the state of Michigan at 22 violent incidents, violent injuries per 1,000 people. Number 2, at 18.9 is Detroit. Number 3 is St. Louis, and it goes down from there. We don't have any others in the top 10, fortunately. But number 1 and 2 is Flint and Detroit. This number, over $250 million, this represents the estimated life loss by CDC. They estimate this by the number of people who are killed or injured in a state in this age group, and they estimate both medical costs, rehabilitation costs, and employment costs. So if somebody doesn't work or cannot work, what that costs in terms of what they're not making, and also what it costs in terms of keeping them functional. $250 million. If we can make a dent, a 10% dent into that, it'd be $25 million. So it doesn't take much to make a big difference. So one of the things that we look at is some of the risk factors that relate to kids' violence, and we think about, in public health, we think about prevention. While we also think about harm reduction, in terms of violent behavior, we're most interested in prevention and how do we get kids not to be violent in the first place so that we don't go into these expenses, and you can imagine what the other expenses to family and community cost as well. So risk factors are those factors that increase the chance that an adolescent would actually engage in a behavior, and in this case, a violent behavior. So what are some of the risk factors? Well, poverty is the most significant one. Somebody earlier asked me, well, what about the economic downturn? There's no doubt that in economically downturn times, or in economic depressed places, there are less opportunities, there is poorer education, there is more violence that the kids are seeing in their neighborhoods, there's more substance use and drug dealing that's going on in the neighborhoods, there is more abandoned homes, more places for these things to go, to happen. There's fewer police officers, and fewer support services. Poverty is related to violence. It's related to a whole host of other things, but it's certainly related to violence. Family violence, if you come from an abusive family, the chances are that you too will become violent in some way. You may not be abusive, but you'll be violent. You might be a bully, you might be something, but it increases the chances. And then also being a bully. Being bullied is often an underlying cause for violence because people are become stressed out. They then act out against the feelings that they're getting beat up on, so to speak, both psychologically as well as physically. And so being bullied is another risk factor. We're, however, really focused on more of the positive factors in life. Even though there's poverty and that increases risk and family violence, not all kids who are poor become violent. Not all kids who have abusive parents or in abusive relationships become violent themselves. And what we're interested in is trying to understand who those kids are. And I'll talk a little bit about the theory behind that in a minute. So what are some of the protective factors? Those factors that help kids overcome the risks that they face. So why do some kids have this risk and not result in violent behavior while other ones do? Well, first is identity. Both personal identity, having some self-esteem, having a sense of belonging, a sense of connection, having a sense of who they are and that they are a valuable person. That's number one. It might be racial or ethnic identity, but that's one of the factors that we pretty consistently are finding to be related to or helping kids overcome these negative risk exposures. Adults, we find that positive role models, mentors, connections with adults are positive, provide positive experiences, positive role models, and examples for their kids' lives. So adults play an important role in protecting kids and helping kids overcome these risk factors. And then we find that participation is. And participation refers to the idea that kids are involved in some kind of community activity, whether it's a boys or girls club, whether it's a sports team, whether it's chess club, whether it's something through the churches, or something in a community-based organization that's providing some kind of service. And we're going to talk about some of the things that we're doing to try to help kids get engaged in all of these kinds of activities: identity, adults, and participation. So that, by the way, is a real picture of kids doing some work in a garden up in Flint. So here's the theory part. So hopefully you're still with me. I heard one head shake, and I wasn't sure if that was a nod that went like this, or if it was, no, kidding. Theory. Theory is important to us in academia, in the work we do, and it really is, on a layperson level, we use theory all the time. When your car doesn't start, you have an idea of why it doesn't, and you go check the battery. And if the battery is alive, then you go check the gas tank. If the gas tank isn't alive, then you call AAA. But basically, we're always testing out our own ideas all the time, and so we try to be a little bit more systematic in terms of what we're going to do when we spend public dollars, for grant dollars, when we go to NIH or CDC or sometimes the state of Michigan. We want it to be driven by some a priori idea about what we think might work. So it helps us guide us in our research, it helps us plan, and it helps us think more clearly. So the two theories that we've applied in the work that we've done is empowerment theory. And empowerment theory is basically the idea that involving youth in the solution is itself a solution, that youth can be resources. So empowerment theory suggests that we look at youth as strengths rather than problems that need to be fixed. That's a completely different way of thinking about the world than if we went and said, okay, all the kids need to be fixed and we have to figure out some way to fix them. So we try to engage them then in developing the skills that they need to then be engaged in community. And I'm going to talk about those hopefully by the time you wake up. The second theory is resilience. We talk about resiliency theory because what resilience